Welcome to the Congressional Neuroscience Caucus and the Rare Disease Congressional Caucus's briefing session on rare diseases on the brain, paving the way for new therapies. I would like to thank our briefing partners for making this briefing possible. And would also like to thank our Rare Disease Congressional Caucus co-chairs, Senator Orrin Hatch, Senator Amy Klobuchar, Representative G.K. Butterfield, and Representative Leonard Lance, as well as our Congressional Neuroscience Caucus co-chairs, Representative Kathy McMorris-Rogers and Representative Earl Blumenauer. So this is the agenda for our next hour. I am your moderator. My name is Christine Brown. I'm the Executive Director of the National PKU Alliance. And then we also have with us some panelists that will be introducing themselves as we go. So I'm going to go ahead and start. So I'm the Executive Director of the National PKU Alliance, and I have 2 children that have a rare disease called PKU. Our organization was formed a decade ago to improve the lives of individuals living with PKU, and we also have a very strong research agenda to pursue a cure. So you might ask, well, what is PKU? So PKU stands for phenylketonuria. It took me about 6 months to actually be able to pronounce that correctly. It is a rare disease that affects about 20,000 Americans. It's an inborn error of metabolism, but essentially at its very core, it's a brain-threatening disorder. So as I sit here and look around the room and I see Diet Cokes and I see sandwiches with bread and cheese and meat and cookies made with flour and croutons in a salad made with flour, all of those things that you're eating and the potato chips all contain protein. And one of the parts of protein is called phenylalanine. And in people with PKU, they cannot process that protein that you are taking. And so in the rest of us, we all have an enzyme that processes that protein into essential neurotransmitters in our body. But in PKU, there's a mutation in the phenylalanine hydroxylase enzyme, which does not cause protein to be able to be processed. And so what happens is protein actually accumulates in the blood and is passed to the brain, and it becomes toxic. And so what happens in PKU, if it's not diagnosed through newborn screening and treated immediately, it causes severe intellectual disability. In fact, in the 1960s, the leading cause of people in mental institutions across our country was actually undiagnosed PKU. In addition, it can cause seizures, it causes microcephaly, as well as skin rashes and eczema. So luckily, and I feel very fortunate, in that PKU was the first disease that was diagnosed or put on the newborn screening panel. And so unlike some of the other panelists that you're going to hear from, I never had to go through an odyssey for 4, 6, 7 years to figure out what was wrong with my children. My children were diagnosed at birth. And so right now in the United States, we have something called the RUSP, which is the Recommended Uniform Screening Panel. This panel is put out by the Secretary of Health and Human Services, along with the Secretary's Advisory Council. And right now they recommend that all states screen for 35 core conditions, including PKU, and 26 secondary conditions. The newborn screening program is, in my eyes, and I think in many people's eyes, it is the most successful public health program that we have here in the United States. Each year, 5,000 babies are identified with a newborn screening condition, and all of these babies that are born do not present any symptoms at birth. They look completely normal, and without this program of newborn screening in all of our states, severe intellectual disability as well as death could occur in many of these babies. And the Newborn Screening Saves Lives Act will be up for reauthorization next year. So this is a picture of my 2 children with PKU on the day of their birth. Connor, who I'm holding in the picture, was born in August of 2005, and Kellen was born in November of 2007. And I think like most parents who have a positive newborn screen, we had no idea what PKU was. When our hospital called and said that Connor's newborn screening test had come back positive for something called PKU or phenylketonuria, we had no idea what that was. We were told not to go on the internet. So tell me, when someone tells you not to go on the internet, what do? You go on the internet. Thank you very much. And, what we saw really scared us. I mean, we knew that there was a treatment for PKU. We quickly discovered that. And again, we're very lucky because most rare diseases do not have treatments. But we also understood that it was going to be very, very challenging, and they were going to be on a very, very restrictive diet. And I remember that first night before we had to be seen in a center in Madison, Wisconsin, which was a 3.5-hour drive away for us. I remember the night before, and I was rocking Connor, and I was breastfeeding him. And I didn't know at that point that I could still actually breastfeed him. I knew he would have to be on a special medical formula. And I have to tell you, as I was rocking him back and forth, I felt like I was feeding my baby poison because his body did not know how to process that protein. Now, I can say that, PKU is the success of newborn screening. This is a picture of Connor and Kellen today. Connor is 12. He's the one that is sitting down on the cube. This week, he's at a coding camp. When he grows up, he wants to be the lead hardware designer for Apple. Or, for some reason, he wants to be the Chancellor of Germany. I don't know if that's because he recently started taking German in school, but he's very interested in his heritage and in Germany for some reason. He also plays football, and he's a wrestler. He does have executive function issues, though, and he has been on treatment since birth, and his levels have always been very, very good. In fact, next year, at the recommendation of his principal, he will be put into a special program, and a year-long elective course that will hopefully help him with his organizational skills, and remembering to write things down and remembering to do his homework. Kellen, who's behind him, is 10. He's actually our third child. Our first child does not have PKU. And so he's definitely the one who is the most humorous. He's the one who's going to give me my run for my money. He's the one who tells me that he hates having PKU. And he's the one that cries and says, "Mom, I just want to be normal." Kellen either wants to be a lumberjack or a police officer when he grows up, and he plays soccer. So, for us, PKU is our normal. It's our new normal. It took us a while to get there. But as I was thinking about what I was going to say today as a parent, what it's like to raise a child with a rare brain disorder, I have to say that most of my interactions with my children, particularly in the morning as we're trying to get them out the door for school, all centers around their PKU. Connor, we call his medical formula his milk. Connor, did you drink your milk? 60 seconds later, Connor, how's that milk? 60 seconds later, Connor, are you finished with your milk? Did you take your medicine? Everything is around their PKU. It's not around, I hope you have a great day at school today. Let's talk about that test you're going to have or this class that you're struggling with. My conversation as a parent is all around the disease and not around the other needs of my children, particularly when we are in time crunches. The other thing that, again, is a new normal for us is everything that goes into my children's mouth has to be weighed on a gram scale and has to be calculated for the amount of phenylalanine in it. And every morsel that goes in their mouth determines the health of their brain. And that's a lot of stress, and it's a lot of pressure, and it's also a lot of stress and pressure to get my children to understand that what they eat keeps their brain either healthy or will make their brain unhealthy. PKU takes a lot of hours of organization, a lot of remembering of things and writing down. And unfortunately, these skills that you need to plan and prioritize and organize are things that many teenagers and adults in our community really struggle with. In addition, medical foods treatment has been the mainstay of therapy in PKU for more than 50 years. And thank goodness that medical foods, which is formula and low-protein foods, Thank goodness that they prevent severe intellectual disability from happening. But by the time that our children become teenagers and adults, most of them can no longer control their PKU with the tools that we currently have available. In addition, new research is showing that even in early diagnosed and well-treated children, there's differences in both the white matter and the gray matter structures of their brain. And so in our community, 91% say that the development of new treatments is important for them. So again, the mainstay for treatment for PKU is medical foods. This includes a medical formula that makes up all of the other amino acids that makes up protein, but they've taken the phenylalanine away from it. Now, I don't know if any of you, like women or men in the audience, drink protein shakes or anything like that, before a workout or after a workout, or, some athletes or dragon boat rowers, in the room. Those taste good, okay? These taste terrible. They taste like sour milk. Or they're very, very salty. They're very, very metallic-y. And a lot of companies have tried to improve the taste, but it's still an issue. Trust me, none of you would want to drink one of my kids' medical formulas. Our cat likes it, but that's about it. And so then also, it's a very, very restrictive dietary management. My boys get about 6 grams of natural protein a day. And again, challenges still remain. We have a patient registry, and it's interesting to show that right now our patient registry is reporting anxiety and depression diagnoses that are sky high compared to the normal population. I think for anxiety, it's something like 34% have a diagnosis of anxiety and 26% have a diagnosis of depression. In addition, ADHD runs about 35% in our population. A lot of people talk to me about a brain fog. They feel like their brain is in a fog and that they're moving very, very slowly. A lot of them also have slow reaction times. Luckily, there's a lot of innovation happening in PKU. 10 years ago, we had one company that was interested in developing new therapies for PKU. We're now up to about 20. Some patients can manage their PKU on prescription drugs. We had one prescription drug that was approved 10 years ago, and a second for adults, which is an enzyme substitution therapy that was just approved by the FDA about 6 or 7 weeks ago. So we're really excited about what this new drug can mean for our adults. I had the opportunity to take a number of the adults that participated in the clinical trial to the FDA as part of that approval process, and their stories were just so powerful. People who wouldn't be able to plan and prioritize their day now know how to make a plan B. Like if they can't get to work one way because of an accident, before they didn't know another way to get to work, and now they can figure out another way. People who, because this drug has been able to significantly lower their phenylalanine levels, thus decreasing that toxicity in their brain, for the first time can read a whole children's book at night to their 7-year-old son. Patients who have been able to increase their salary and go on to supervisory roles in their organizations. And this is all because this drug is able to severely decrease the amount of phenylalanine and toxicity in these people's blood and brains. In addition, we have companies interested in gene therapy, cellular therapy, and engineered probiotic microbes. We've just had 2 companies announce the beginning of phase 1 trials, and there's about 4 other companies that hope to file INDs with the FDA next year in some new therapies. In addition, I just want to mention the Global Brain Health Act, and this really focuses on the brain health of Alzheimer's, autism, and other forms of dementia. But still, that can also help inform other rare diseases, particularly in the brain. Lastly, I do just want to touch upon access. So as I said, medical foods has been used to treat PKU fairly successfully for more than 50 years. However, most insurance companies will not cover medical foods because they're not classified as prescription drugs. and you're dealing with a rare disease, and insurance companies really don't know what to do with us. And so I have been walking the halls of Congress for 10 years, trying to work on legislation that would require all private and public health insurance programs to cover the cost of medical foods for PKU, other similar inborn errors of metabolism diagnosed through newborn screening, as well as certain GI conditions that also use medical foods. What I like to say is that we finally had our first success on a federal level 2 years ago when the Department of Defense reauthorization bill was passed that actually extended coverage without age limits to our military families that have TRICARE. And now that our military families have it, we're really advocating that all Americans have access to the treatment that they need to prevent severe intellectual disability. I would also just like to mention the other issues that we have with access is as new therapies come down the pike and come down the road, they're expensive. And so we are concerned about, access based on closed formularies, as well as utilization management tools that could possibly decrease access. And in many of these rare diseases of the brain, if you don't have access, you can have significant deficits very, very quickly. So I thank you for your time and for being here, and I am now going to pass it on to the next speaker, who's Louise Vetter. She's the president and CEO of the Huntington's Disease Society of America.